morning. Convening our joint committees on health and homelessness and human services. Today is Thursday, March 14th, 2024. It's 11:30 a.m. in conference room 329. We have a number of bills on here, with the last two bills being joint health and human services bills. First up, members, related to Senate Bill 3129. This is the Hui Ho'omana Task Force within the State Health Planning and Development Agency. Chair's recommendation is going to be to defer this, as I will be rolling some of this into the latter bill on the State Health Planning and Development Agency. Questions, comments, or concerns? Okay. Members, on Senate Bill 2605 relating to healthcare, this is our Women's Legislative Caucus insurance mandate for reproductive healthcare services. Members, we've had a very informative conversation that's been occurring throughout session with respect to this bill, learning more about the intersections between prepaid healthcare, the ERISA preemption, as well as the Affordable Care Act. This is a very, very difficult area of law. Very difficult area of public policy, but the critical importance of reproductive health care in our state is something that we, as a legislature, have been very good about making sure that we are at the forefront. Given the complexities of this, I do want to move this bill forward, but I am going to make a number of amendments that I think will address some of the many concerns, and we'll continue the conversation about how we can ensure reproductive health care access, equity, and care in our community. So members, taking you through this bill on Senate Bill 2605, Chair's recommendation is to make a number of amendments that include removing throughout the bill for the identified benefits under preventative health services, abortion and pre-exposure prophylaxis, post-exposure prophylaxis, and human papillomavirus vaccination from preventative services throughout. Members, this is because these are specifically not identified and in many ways called out through various ACA statutory and regulations that we have on the books. It's also not services and benefits that are identified specifically in the Prepaid Health Care Act. I would like to note in the committee report that the next committee should review whether anything on this list or on the list throughout this bill is not covered by the state's EHB benchmark plan that sets the requirements of EHBs as required by the ACA HMSA's Preferred Provider Plan of 2010 as of January 2014, and the state's current prevalent plan as approved under the requirements of the Prepaid Health Care Act. I will also ask that noted in the committee report, the next committee should inquire into how payments are made by the employer for selected plans and what are the processes for individuals to access additional insurance and make payments for services that may not be covered by their employer's offered health insurance plan. We're going to create a part 2 that creates a working group led by the insurance commissioner and includes the following: the director of Department of Labor or his designee, the administrator of the Disability Compensation Division within the Department of Labor, a representative of the Prepaid Healthcare Council. I believe that, members, is the body that oversees the defining of the prevalent plan annually. The administrator of the MedQuest Division, administrator of the DCCA PVL Division, a member of the School of Nursing, as well as JABSOM and ACOG, a member of Hawaii Women Lawyers, and a member of the Hawaii State Bar Association with expertise in labor and employment law, and anyone else identified by the insurance commissioner. The task of this working group will be to examine barriers and gaps for reproductive health care leading to health inequity in our state, identify state laws, rules, or administrative practices that are barriers to the provision of effective reproductive health care, and 3, submit a report to the legislature of its findings, recommendations, including any proposed legislation to the legislature prior to the convening of the regular sessions of 2025 and 2026. The topics studied should include scope of insurance coverage across different plans, cost and affordability of reproductive health care services, telehealth policies that hinder or advance access to care, workforce shortage areas that impact availability and accessibility to reproductive health care services throughout the state, and past and current litigation concerning these areas, including any active Affordable Care Act litigation that may impact any of these topic areas. We're going to have a effective date of July 1st, 3,000, and for the remaining benefits that will move forward in the insurance mandate, these shall apply to all plans on or after January 1st, 2026. Any tech amendments identified by HMSO. Members, any comments, questions, or concerns?
Question, Chair.
Yes, Representative.
Just to clarify, the services that you're removing for coverage, you said abortion and which vaccine?
It's pre-exposure prophylaxis, post-exposure prophylaxis, and human papillomavirus vaccination.
Got it. And abortion services as well.
Yes.
Okay, thank you.
Okay, members, again, this is a very difficult area of law, but for me, one of the really important things is that we have to ensure access. And access means both insurance and physical access to services. I think the fact that that things like homeless individuals giving birth on the streets of Hilo should raise a big red flag that we have a problem of access in our community. It may not be about insurance. It may, at the end of the day, be about many other things. We have a great insurance plan under Medicaid. We have very good plans, prevalent plans, and I wanted to also acknowledge the concerns that, we want to make sure that the essential health benefits that might have been extended through ACA and are covered by prepaid, like cancer, that Chair Martin was concerned about, remain in here. So we're trying to do this very surgically, very strategically, both to ensure and make sure that laws we pass are protective of our Hawaii healthcare ecosystem. Members, any other questions, comments, or concerns? Representative Kobayashi and then
Just
Chair.
comment, the insurance coverage would begin after January 1, 26 or 25?
2026.
26, thank you.
This will provide and allow us to make sure before anything becomes active, if we need to make any kinds of changes, to make sure that we are complying with prepaid and ACA. This accommodates that process that the Commissioner Ito had alerted to us regarding EHB changes via the ACA.
So I think we should make it clear that we want to stay away from anything that might endanger Hawaii's ERISA exemption.
Absolutely. We can include information about that in the committee report. And I will also inform members that I've started to alert our congressionals, because I think, as a legislative body, we have not really looked at this, but we need to understand the complexities of this area at all levels of our elected officials. Chair?
I just wanted to comment that I'll be voting for this. I wouldn't want to vote with reservations and have people think I didn't support the intent of the bill, but I'm not happy about the very cautious approach being taken, but I'm glad you're moving it forward.
You're welcome. I hear you. I think we need to be cautious in this area because the upsetting of prepaid healthcare is fundamental to cost of living here in the state of Hawaii. While we struggle with cost of living housing issues, it is healthcare in the one place that we have one of the best affordability rates in our community, and it's mostly 100% because of the Prepaid Healthcare Act and the compromises that were forged in 1974. All right, members, questions, comments, or concerns? Vice Chair for the vote.
Voting on SB 2605 ST2, Chair's recommendations passed with amendments. Chair and Vice Chair vote aye. Representative Amato?
Aye.
Representative Iligan?
Aye.
Representative Kobayashi?
Aye.
Representative Martin? Aye. Representative Nishimoto?
Aye.
Representative Garcia?
No vote.
No vote for Rep. Garcia. All others vote aye. Chair, recommendations adopted.
Okay, members, moving to the next bill, Senate Bill 3128, relating to Act 212, Session Laws of Hawaii 2021. This is with respect to the transfer of HHSC Oahu Region into the Department of Health. Chair's recommendation is going to be in session law to essentially extend the transfer date to 2026, and then include and keep the amendment that was added by the Senate in this measure that would require that the Oahu Regional Healthcare System and the Department of Health shall enter into an agreement regarding Oahu Regional Healthcare System taking care of low acuity patients in the Department of Health's custody by the end of 2024. This is to ensure that, remember, this piece is actually to ensure that we can have a flow of a continuum of care from state hospital to community. Also, I'm going to request that the working group be reactivated to submit reports to the legislature no later than 20 days prior to the convening of the regular session of 2026 to update its initial report and provide more granular data about the costs that will be incurred to effectuate the transition of Oahu HHSC region into the Department of Health. Also, I'm going to be inserting a clause that directs Oahu region to provide and submit a report 20 days before the start of the 2026 legislature, informing the legislature about all of its projects that it identified in its testimony about its partnerships to ensure that better use of its facilities, in addition to how it's addressing the intent of this legislative body to ensure that the facilities of Oahu region be part of the continuum of care for long-term care and mental and behavioral health services in the state of Hawaii. And any tech amendments identified by HMSO and the defective data 3000. Members, comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 3128 SD2, Chair's recommendation is passed with amendments, noting all members present. Any reservations or noes? Hearing none, Chair, recommendation is adopted.
Okay, members, for Senate Bill 2837, this is with respect to the Oahu Regional Healthcare System, the State Maui Veterans Home. Chair's recommendation is to add draft an HG1 that amends the purpose in the preamble to state the purpose of this act is to temporarily authorize the Oahu Regional Healthcare System to oversee the operations and management agreement of the proposed state veterans home on Maui, and to set forth the timeline and process whereby permanent oversight of the operations and management agreement of the proposed state veterans home on Maui will be reassigned from the Oahu Regional Healthcare System to the Maui Regional Healthcare System. At page 2, we'll amend the subsection 1 to read, the Oahu Regional Healthcare System, which shall have temporary ownership and oversight of the operations and management agreement of the proposed state veterans home on Maui. At page 2, amend subsection 3 to read, the Maui Regional Healthcare System, which shall secure ownership of the land of the proposed state veterans home on Maui and have permanent oversight of the operations and management agreement of the proposed state veterans home on Maui. Inserting language that will say that no later than June 30th, 2027, the Maui State Veterans Home shall be assigned temporary ownership and oversight to the Oahu Regional Healthcare System. No later than June 30th, 2028, permanent ownership and oversight of the operations and management agreement for the Maui State Veterans Home shall be transferred from the Oahu Regional Healthcare System to the Maui Regional Healthcare System. We're going to add a new subsection C to section 3 that states at least 30 days before the convening of the 2025, 2026, and 2027 legislative sessions, the Maui Regional Healthcare System shall submit a report to the legislature on its progress in reconstituting its board and managing entities to facilitate the regional system's ability to accept ownership and permanent oversight of the operations and management of the proposed state veterans home on Maui from Oahu region to ensure that any benefits, including revenues and other community benefits, shall be used first to reduce any state subsidies to Maui health systems, and secondly, for the benefit of healthcare within the Maui health system. Add a new subsection D to section 3 that states at least 30 days before the convening of the 2025, 2026, and 2027 legislative sessions, the Maui Regional Healthcare System and the Department of Defense and the Oahu Regional Care System shall submit a joint report on the progress of the Maui State Veterans Home, including the determination and finalization of the location of the site for the Maui State Veterans Home and the securing of federal funds for the Maui State Veterans Home. A effective date and any tech amendments identified by HMSO. Members, comments, questions, or concerns?
Comment.
Yes.
Thank you, Chair. I just want to say thank you for these amendments. I'm happy to support this bill now. Thank you so much.
You're welcome. Okay, any other comments? Representative Kobayashi.
So this basically kicks the can down the road and reactivates the Maui board, which right now consists only of volunteers.
The Maui board, it was supposed to have been maintained, and they have actually been, in many ways, failing their duties. There's also Maui board members that have been named, I believe, as we heard in the testimony, to the Maui health systems. So this is actually holding them more accountable, Representative, and it's going to ensure better accountability. And that's what I'll leave it at.
Okay, thank you. I'm concerned that without some staffing and money, they won't be able to make proper decisions as to what their role might be.
I will leave that to HHSC region corporate, HHSC corporate, because they still have some obligations to the regions under the current statute. There has also been communication, I believe, from the person who is the one remaining board member that they are taking steps to reconstitute. And to your point, Representative, I think we can ask that before this comes before the next committee, that the person who is sitting on that board representing Maui be present at the next committee hearing. Okay? Hope that relieves some of your concerns.
Yes.
Okay, Vice Chair for the vote.
Voting on SB 2837, SD2, Chair's recommendations to pass with amendments. Noting all members present, any reservations or noes? Hearing none, Chair recommendations adopted.
Thank you. All right. Members, this is our crisis intervention bill, Senate Bill 3139. Again, another difficult area, but something that we have to work on to ensure that we address the mental health issues throughout the state. We're going to add a new definition into 3341. We're going to preserve both the mental health worker, but we're going to add a definition for crisis intervention officer pulled from Senate Bill 2345 SD2. We are going to, where we amend and add designated by the director or a crisis intervention officer on at page 7 of SB, at page 7, line 21, we are going to have this amended language take effect on July 1st, 2026. This will provide a phased-in approach where the crisis intervention officers, the law officers, will be able to get trained up to that, then be able to make the referrals directly either to the emergency room of hospitals or to hopefully what will be a more robust system of crisis centers that we have up on the different islands. At page 13 of Senate Bill 3139 SD2, we're going to add a new section designated as Section 353C that essentially authorizes crisis intervention training and crisis intervention officers. This is a section that will be pulled from Senate Bill 2345, Senate Draft 2 at page 2. This section shall become effective on July 1st, 2024. We need this so that they can begin training and begin the process of training officers across the islands, our island state. We're going to add funding sections representing 3.0 FTE crisis intervention coordinator positions to administer and coordinate the crisis intervention training program through DLE. We're going to include a defective effective date, any tech amendments by HMSO, and let me just rephrase, the amendments in the DLE testimony for this bill, we'll be adding all of that into the draft. This is the language that directs them to be able to help decide where they're going to, where and under what conditions they're going to divert either to emergency room or to a crisis center. Members, questions, comments, or concerns? Yes.
So with this, do we still need SB 2345, or did you add it all in here? Are you combining the bills?
I'm essentially combining the bills. We may want to continue to hear Senate Bill 2345, which I think has a different referral, but I think it does capture the main essences of what's moving in both of those bills. And we were provided the key information through the testimony of the Department of Labor through DLE. Any other comments, questions, or concerns? Okay, Vice Chair for the vote.
Health Committee voting on SB 3139, SD2, Chair's recommendations passed with amendments. Chair and Vice Chair vote aye. Representative Amato?
Aye.
Representative Iligan?
Aye.
Representative Kobayashi?
Aye.
Representative Martin?
Aye.
Representative Nishimoto?
Aye.
Representative Garcia?
Aye.
Chair recommendations adopted.
Thank you, members. Last bill on our agenda. Human Services. Go ahead.
Same recommendation, passing with amendments for Human Services. Vice Chair, please take the vote.
Thank you, Chair. Voting on SB 3139 SD2, Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Representative Bellotti.
Aye.
Representative Iligan.
Aye.
Representative Kobayashi.
Aye.
Representative Takanuchi.
Aye.
Representative Nishimoto.
Aye.
And Representative Garcia.
Aye.
Thank you, Chair. Your recommendation is adopted.
Thank you, members. Last one, and I apologize, these are very difficult bills, but I think we're close to getting to better bills. Senate Bill 2285 relating to the State Health Planning and Development Agency. Members, the core ideas in this bill and the bill that I deferred earlier, which was Senate Bill 3129, was or is to beef up the State Health Planning and Development Agency so that they actually can write a plan that is more usable by the legislature. So Chair's recommendation is going to be to amend the language at page 2. So we're keeping the first paragraph that says universal access to high-quality, equitable, and affordable health care for all people of the state. We're going to amend subsection 2 to say provide throughout state government coordination of activities that affect healthcare access, quality, and cost, including, and then keeping all of those listed items. We're going to amend so that the plan, the State Health Services Workforce and Facilities Plan, which is the key part in this bill, to be provided to the legislature 20 days before the 2026 legislative session. Yes, so in 2 years' time. That gives them enough time to be able to really better flush out what this plan is. We're going to take out the subsection on annual global budgets. We're going to amend at page 4, the state agency may prepare such reports and recommendations. We're going to take that subsection B and move it to the bottom of this subsection so that the related health statistics as necessary to monitor and improve healthcare access is going to be blended into what the state agency will make reports and recommendations upon. Then we're going to move in to this bill, the Ho'omana Task Force members. We're going to adjust the membership to have more, to include relevant government agencies as well as key people in the healthcare industries from the healthcare hospitals, so the Healthcare Association of Hawaii, Hawaii Primary Care Association, a representative from the healthcare plans, as well as other community members or other members identified by the SHIP-D chairperson. We're going to strip the distinction between voting and non-voting members and make other technical amendments to the working group. Members, questions, comments, or concerns? This task force or working group will be tasked with helping to develop the plan that's identified in this in the bill.
Effective date?
Yes, and a defective date, and any tech amendments identified by HMSO. Members, comments, questions, or concerns? All right, seeing none, Vice Chair for the vote.
Health Committee voting on SB 2285 SD2 Chair's recommendations passed with amendment, noting all members present. Any reservations? Any noes?
No vote.
No vote for Rep. Garcia. All others vote aye. Chair recommendations adopted.
All right, for Human Services Committee, same recommendation.
Thank you, Chair. As voting on SB 2285 SD2, Chair's recommendation is to pass with amendments, noting the presence of all members, Chair and Vice Chair voting aye. Any other members? Any members voting no?
No vote.
No vote for Rep. Garcia. Any members with reservations? Thank you, Chair. Your recommendation is adopted.
All right, thank you, members. We are adjourned.